The coronavirus is dangerous, partly because people often have it for days or longer without understanding the seriousness of their condition. Being able to recognize the symptoms of COVID-19 is really important so that we can help minimize spread of this disease. The most common symptoms of patients who have COVID-19 are really cough and fever. When people ask me, what do I expect? I generally say it feels like the flu. For many patients, the first symptom is fatigue. They report being more tired than usual. Others complain of sore throat, headaches, generalized muscle aches. Patients can also present with confusion, dizziness, poor concentration, lack of motivation. In a small subset of patients, they can go on to develop much worsening symptoms such as bluish discoloration around their lips or face, chest pain, chest pressure, feelings of shortness of breath with activity or perhaps even at rest. Again, the majority of patients who contract COVID-19 will experience a relatively mild illness. Most of them will get better in 5, maybe 7 days. That certain subset of patients that worsens after 7 to 10 days with chest pain, shortness of breath, or changes of skin color around their face will very likely need to be evaluated in the hospital. When we monitor symptoms, it's very important that we write these down in a notebook. This is part of tracking the disease course. We need to note the date, we need to note the time, we need to give a detailed description of how we are feeling, or if we are the caregiver, how is the person that we're caring for feeling. This should be done on a frequent basis. For example, be sure to track these symptoms, such as if you feel more tired than usual, if you have a headache, if you have sore throat. Certainly if you have any sense of chest tightness or shortness of breath, that would be important to keep track of. One key symptom to track with COVID-19 is the presence of fever. Now, fever in and of itself is generally not dangerous. It is the body's normal response to fighting an infection, whether that be from a virus or from a bacteria. That being said, if a fever does exceed 103 or 104 degrees, that certainly may be cause for concern. You can check your temperature with a thermometer. There are many different types available. Again, if the patient is feeling well enough to record their own temperature, that would be advisable just to minimize spread of disease. Again, the 3 basic rules: wash hands, don't touch our face, and lastly, appropriate social distancing. By having someone record their own temperature, we are helping to follow the first part of the basic rules, in that we are not touching everything as they are. Helps reduce chance of infection. Now, another thing we should track is really someone's breathing rate, what I call respiratory rate. And that can simply be done by counting the number of breaths that they take in a minute. Normally, that may be somewhere for an adult between 12 and 16 or 18 breaths in a minute. If someone is breathing much faster than that, that really could indicate a more significant problem. And if associated with shortness of breath, would certainly be a reason to have them evaluated in the hospital. Another way to assess how someone is breathing is with a device called a pulse oximeter. These can be available at most pharmacies, and they can be purchased over the counter. But this device helps to determine someone's oxygen level. Now, a typical oxygen level in a normal healthy person will likely be 95% or greater. There are certain underlying conditions that may affect this, such as COPD, or actually with increasing altitude. But it certainly is a good baseline to keep track of in the documents that we're keeping at home. Again, the usual symptoms of COVID-19 are cough, fever. Once it advances, and if someone is to experience things like chest pain or shortness of breath or bluish discoloration around the face, that again is cause for concern. And you may be able to pick up on some of this when you're checking someone's temperature, their respiratory rate, and their oxygen levels with a pulse oximeter. For high-risk individuals, in other words, those people with immunocompromised states, diabetes, high blood pressure, COPD, asthma, underlying cancers, these people are certainly more prone to rapid worsening and worse outcomes with COVID-19. So keeping these vital signs, if you will, are even more important to do on a more frequent basis. Please remember, as patients start to feel better, that is fantastic, but they very likely are contagious for a period of time, even after symptoms begin to resolve. A general rule of thumb is if someone has not had fever for 72 hours with the assistance of fever suppressors, meaning they have had no fever and they have not taken a fever suppressant such as Tylenol, and their symptoms have resolved, they are very likely past the point of being contagious. It may still be advisable for them to wear a mask for several days, again, to minimize possible spread of the disease. If someone has had, in fact, a positive COVID-19 test and their symptoms have improved and at least 7 days have passed since the onset of first symptoms, these individuals are also likely no longer contagious and can resume normal activities. Again, please follow the 3 basic rules as you are recovering from this illness to minimize spread throughout our communities.